Hey, Dr. McNamara here, and today I wanted to go over a quick warm-up and a stretching routine that's going to hit all the major muscle groups that tend to get tight on most individuals, definitely myself included with that group. So we're not going to hit every muscle group, so if there is any specific muscles that we didn't get to in this video and you would like to learn how to stretch those because they tend to be really tight on you in particular, please leave a comment below and we will make some future content regarding those stretches. So let's go ahead and we'll get started with our warm-up. We're just going to do some controlled articular rotations and we're going to start with our neck. So then to do this, we're going to start by retracting the neck, dropping the chin to the shoulder, and just starting to rotate. Using our chin as the lead. Get to that end range, drop it back, gives me a full circle. Okay. And we'll just keep going this direction. We'll do about 5 on this side, and 5 on the other. Maybe a little snap, crackle, pop. That's totally fine. And if you're having any pain during this movement, try to avoid those points where there's pain and just skip past it and move on. Then you'll notice as you're doing these stretches that pain might just go away and hopefully stay away for good. Okay, so that is the cervical spine. Now we're going to do our thoracolumbar spine. So for these, we're giving ourselves a big hug. And then we're going to try to imagine each vertebra kind of moving individually and rotating on top of the other one. So a little bit of visualization here. So we're going to tuck again, flex everything forward, and then we're going to start rotating. About 5 one direction. Going nice, slow, controlled, really engaging a lot of core musculature here. Now the other side. Better like this. And you may notice it's a little bit easier to go one side versus the other, and that's normal just because we tend to do most things unilaterally with our dominant hand. This is a good way to kind of counterbalance everything. You'll see some bigger discrepancies when I get to the shoulder and the hip, for myself at least. Just say this is the last one. Okay. All right, now my spine is nice and limber. Now we'll go ahead and do the shoulder joint. So for this, we're gonna go thumb forward. Actually, before we do the shoulder joint, let's do the shoulder blades. That's part of the shoulder joint. So for this one, we're gonna do scapular retractions with a little bit of depression and elevation as well. So I'll try to show it here. First one is going to be depression, so pulling it down with retraction, then retraction with elevation, retraction or protraction with elevation, protraction with depression. Okay, so we're making a big box. We'll do about 5 one direction. Then 5 the other. Okay. That's about 5. Okay. So that was for the scapula. Now for the glenohumeral joint, the actual shoulder joint. So for this one, we'll start with the left side. And you're gonna start with thumb forward, and you're gonna bring that arm straight up, keep everything kind of contracted through, and then you're gonna hit that end range. We can't go any farther, so you're going to rotate externally, and then keep rotating on the way down till we're at the bottom. And we go back up. Okay, so that's one. Let's do 4 more. Last one here. Okay. That a little bit, then we'll do the other side for the right. So again, thumb forward, kind of contract everything through, start lifting up. And then my right side feels a lot more mobile than my left side. One, 2, 4 more. And then just so we get that lower extremity as well, we're going to do some hip CARs. And I'm just going to do them standing. You can also do these on all fours as well, but it's the same idea. You're trying to get to that joint through all different ranges of motion. So for this one, so reflection, external rotation, extension, internal rotation, down. That was a nice pop in that hip joint right there. Felt really good. Excellent. Let's do the other side. Ooh, this side's pretty tight. Ooh, ooh, ooh. Involve some balance as well. Now we got the body nice and warmed up. Joints are all moving. Now we're ready for a little bit of stretching. So I will go ahead and show you those stretches right now. All right, so this is the portion of the PAILs and RAILs that we're doing today. We'll get into science or why we did the CARs beforehand. I just want to talk about the stretch I'm doing right now. And right now I'm demonstrating a hip flexor stretch. And as you can see, I'm starting with the passive stretching, which is just 30 seconds, relaxing into the stretch, allowing the target muscles to lengthen naturally. So kind of like your typical stretches that you would normally do. So for this next portion of the stretch, we're going to do the PAIL, the progressive angular isometric load. This is going to last 30 seconds, and this is where you gradually build tension in the muscles being stretched, pressing into the stretch without any actual movement. So as you can see, it won't visually look much different from what I'm doing, but I am starting to contract my hip flexors right now. Now for the third portion of the stretch, it's called the RAIL. This is the regressive angular isometric loading. This is going to be held for around 20 to 30 seconds. It gets pretty difficult, so that's why I typically will only hold for 20, but if you can handle it, go ahead and hold for that extra 10 seconds. And what this does is it's going to activate the muscles on the opposite side, attempting to deepen the stretch by pulling yourself further into the position. You'll notice a huge gain in range of motion when performing this part of the stretch. And then at the end, the last portion of the stretch is going to be the last passive portion, and that's going to be held for 30 to 40 seconds for the duration of the total 2-minute time. And this is where you're just going to return to a relaxed stretch. Now, oftentimes you're going to notice you have a much increased range of motion due to those preceding contractions. So that kind of covers it, and I will be going through the different stretches for the hip flexors, for the glutes and external rotators, as well as the hamstrings, and then we will also do some spinal PAILs, RAILs for the thoracolumbar spine, as well as the cervical spine, and then we will end with a little bit of chest opening shoulder stretches. So you'll see those, but as you're watching that and going along, I'm just going to talk a little bit about why we perform those controlled articular rotations and a little bit more science on why the PAILs, RAILs are such an effective stretching technique. So before we did those PAILs, RAILs, it was really important to begin with those controlled articular rotations. These movements take our joints through their full range of motion, stimulating mechanoreceptors within the joint capsules. This process enhances neuromuscular control and promotes the secretion of synovial fluid, which lubricates the joints, preparing them for deeper stretching and strengthening exercises. Now, understanding PAILs, RAILs. So PAILs stands for Progressive Angular Isometric Loading, and RAILs stands for Regressive Angular Isometric Loading. These techniques involve isometric contractions, engaging muscles without movement, to expand and strengthen our range of motion. By applying force to both the lengthened and shortened sides of a joint, we can train our nervous system to control these new ranges effectively. So what is the science behind the PAILs, RAILs? Well, PAILs and RAILs are effective due to several physiological principles. The first one is going to be reciprocal inhibition. When you contract one muscle group, that causes the opposing muscles to relax, facilitating a much deeper stretch. There's also going to be some isometric strengthening at those end ranges. So by engaging muscles at their lengthened and shortened positions, we build strength where injuries are most likely to occur, thereby reducing this risk. You just think about it, typically when someone gets injured, the muscle is in a position it's not used to. So if we train those muscles to be strong in those positions, it's just going to reduce our risk overall when it comes to injury. It's also going to lead to progressive tissue adaptation. Consistent practice leads to lasting changes in muscle and connective tissue, really solidifying gains in flexibility and strength. These techniques ensure that increased mobility is both usable and safe, enhancing the overall movement quality. Now, while you're performing this routine, remember to maintain steady breathing, focus, and really pay attention to those muscles being engaged during each phase of the stretch. And that mostly covers kind of the science generally on why PAILs, RAILs work and why they're so effective. Now, this is a more advanced technique, so this could be difficult for some individuals to begin when they get started. So I recommend taking this very slow. Play around with different positions to see what feels best for you. And if anything is, extremely painful or really discomfort to the point where you can't perform the stretch, it's probably a good idea to see an expert in your area for a full evaluation and comprehensive examination. Now, I'm going to go ahead and let you guys stretch for the remainder of this video, but I would like to say thank you for watching and enjoy. that covers our warm-up and stretching routine that's really going to hit all the major muscle groups that tend to get tight on most individuals. So I really hope that you guys enjoyed this video and find some value within it. And guys, if you have any questions on any of the different techniques, the different stretches that we went over in this video, or if you would like to see perhaps some other stretches for different muscle groups, go ahead and leave a comment below and make sure to like and subscribe for more health and wellness.